When I first started out as an MDS coordinator, one of my biggest challenges was trying to figure out how to organize my day. There was so much to keep track of: MDS assessments, pain interviews, new admission diagnoses, managed care, and honestly, it felt so overwhelming at first. Trying to stay on top of everything while making sure nothing slipped through the cracks was so stressful. So I had to quickly develop a process, a daily agenda that worked for me and helped me to stay on track. If you're new to the role and you're feeling the same stress or frustration, you're not alone. Stick around because in this video, I'm going to show you how I organize my day as an MDS coordinator to stay on top of it all.
No Stress, MDS, with Mike D. Taking the stress out of MDS, one puzzle piece at a time.
Hey everyone, welcome to No Stress MDS. My name is Mike D. I'm a registered nurse and MDS coordinator. And here on my channel is my goal to provide tutorials, tips, and tricks to help you take the stress out of MDS one puzzle piece at a time. I'm sure you've heard the saying before that failing to plan is planning to fail. And when it comes to being an MDS coordinator, that couldn't be more true. Staying organized and planning ahead is absolutely essential for success in your role as an MDS coordinator. As MDS coordinators, we juggle a wide variety of tasks and responsibilities in the nursing facility. And without good systems in place, it's easy for something to slip through the cracks. And then unfortunately in our role, that can have some real consequences. In my course, I talk about what I call the three major pillars of oversight for the MDS coordinator: compliance, reimbursement, and resident care. The truth is, whenever we drop the ball, one or sometimes all of those areas can be impacted. That's why staying organized isn't just helpful, it's necessary. The role of the MDS coordinator is no small job. These are big shoes to fill. But with the right tools and systems in place, not only can you handle it, you can thrive. In this video, I'm going to walk you through my current process on how I organize a typical day. Now, I do want to point out that how I organize my day may look a little different from other coordinators out there, and that's totally normal. Because an MDS coordinator role can vary a lot from one facility to the next, depending on how the role is structured. Now, with all of that being said, yes, every MDS coordinator role can look a little different depending on the facility, but there are what I like to call some absolutes in this role. These are the core responsibilities that no matter where you work at, you can pretty much bet your life on being part of your job. So let's take a look at a few of the big ones. 1, overseeing the implementation of the REI process. This includes scheduling MDS assessments, completing them, making sure the rest of the interdisciplinary team or the IDT finishes their assigned sections, completing CAS, initiating or updating resident care plans. I mean, it's right there in the title, MDS Coordinator, so it makes sense that you'd be heavily involved in this entire process from start to finish. 2, Medicare utilization. Now, this ties closely into the REI process because PPS assessments are completed for the purposes of Medicare reimbursement. But beyond that, most facilities also expect the MDS coordinator to play a big role in Medicare utilization oversight. That means working with the IDT to make sure skilled residents continue to meet skilled criteria, ensuring the billing conditions of participation are met, and staying on top of things like daily skill charting, beneficiary notices, and maintaining physician certifications. And 3, meeting participation. This is another one you can count on. Because the MDS role touches so many areas of the facility, you'll likely be involved in multiple standing meetings. That usually includes morning stand-up, clinical meetings, QAPI, care conferences, and potentially more depending on your facility. Again, the specifics may vary, but being present and contributing to these meetings is a common and expected part of the MDS coordinator role. Now, of course, there are plenty of other responsibilities that come with the job, but we'll stop here for now. These are 3 of the big ones that you can safely expect to be part of your day-to-day as an MDS coordinator. Over the years, I've used quite a few different versions of daily agenda worksheets to help me stay organized. And honestly, they've changed depending on where I was working and what responsibilities I had at the time. But one thing has stayed consistent. Using a worksheet has been one of my biggest keys to success over the past 12 years. In this video, I'm going to walk you through the No Stress MDS Daily Agenda Worksheet, a tool I created and now share with coordinators I train. I'll leave a link in the description box to my website where you can download a free copy of the worksheet. If you think it might be helpful, feel free to download it, use it, and share it with others. And most importantly, don't be afraid to modify it to fit your specific workflow. Make it your own. For me, having this worksheet filled out before I even start my day really helps me stay on track as things unfold. It gives me a clear plan so I know what needs to be done. And when those inevitable interruptions happen, I can quickly glance at my worksheet and jump right back in without missing a beat. So currently, I'm working as a remote MDS coordinator for a lovely center that has a great mix of skilled and long-term care residents. The responsibilities I'm accountable for are all outlined on the daily agenda worksheet I'm about to walk you through. Now, based on the contract I have, my duties can shift from one assignment to another, but for my current position, this format works very well. The first section of the worksheet includes all of the daily tasks I know I need to complete before the end of my workday. And the very first item on that list is reviewing the ADT. For anyone unfamiliar, ADT stands for admissions, discharges, and transfers. Some people refer to it as census changes or the action summary, but it all means the same thing. I like to start my mornings here, checking for any changes since I last logged in, because each of those changes usually comes with MDS-related tasks that need to be addressed. The electronic health record system my current client uses is Point-Click Care, or PCC. And let me just say, I love PCC. It's one of the more intuitive and user-friendly programs out there. One of its features includes multiple dashboards that pull clinical and administrative data, which has been incredibly helpful in my workflow. The dashboard I use first thing in the morning is the ADT dashboard. It gives me a snapshot of all the admissions, discharges, and transfers within the selected time frame. Unfortunately, PCC doesn't currently allow private vendors to purchase access to a training sandbox for demos, so I've created a mock version of the PCC electronic health record. If you're familiar with PCC, hopefully you should be able to follow right along, assuming your platform is designed with what I most commonly work with. And if you're not using PCC, no worries, just apply the same process using whatever system you have to track your facility's admissions, discharges, payer changes, and transfers. Now, with my current facility, here's what I'm responsible for when it comes to these census changes. For admissions, I complete several items including scheduling the appropriate MDS assessments and entry tracking records, inputting the admission diagnoses, creating the initial care plans, completing the state Medicaid form, preparing the physician certification if the resident admits with Medicare or a Medicare Advantage plan, updating the authorization calendar if the resident admits with an insurance that requires authorizations, ordering the pain interview to be completed by nursing, and requesting the functional GG assessments to be completed by the nursing team. So there's a good bit that goes into getting a new admission fully set up from an MDS standpoint. For discharges, I make sure the discharge MDS is properly scheduled, and I upload the physician certification to close out the episode when applicable. For payer changes, in the situation where a Part A PPS discharge assessment needs to be scheduled, and if I haven't scheduled it already, I'll go ahead and take care of that. If the change involves a hospice enrollment or disenrollment, and there's no significant change MDS scheduled yet, I'll schedule the significant change, order the pain interviews to be completed, and request the GG assessments to be completed by nursing. So whether it's an admission, readmission, discharge, or payer change, I have a standard checklist of tasks that I work through to make sure nothing falls through the cracks. So I typically take care of the discharges and payer changes right away, since the tasks are quick and easy to complete. Once those are done, I close the tabs. However, I keep the tabs for new admissions or readmissions open and write the residents' names down in this box. Next to each name, I write out abbreviations for the tasks that I need to complete. The abbreviations are based on my facility's expectations, and it helps me keep everything organized. Like I said, the tasks that I'm responsible for include inputting diagnoses, so I put a DX, scheduling MDS, I'll put an M, creating the care plan, CP, preparing the physician certification, a C, completing the Medicaid form, an L, scheduling the pain interview, a P, and updating the authorization calendar, an A. As I finish each task, I cross out the corresponding abbreviation, which lets me know that it's been completed. Let's say we have John Doe and Jane Doe admit to our center. John admits with original Medicare Part A, while Jane has managed Medicare. I highlight Jane's name in yellow to indicate that she has a managed Medicare payer source. Now, before I begin working on these admissions, I will finish planning out my day and setting up my agenda. I found it to be more effective to map everything out ahead of time, since I'll inevitably be interrupted by phone calls or something else. Having this worksheet fully set up just makes it easier to jump back in and pick up where you left off. The next item on my daily agenda is my care plan reviews. Now, PCC has a great tool that helps me to stay on top of these reviews, and it can be found under the clinical dashboard. It is called the Care Plans Overdue Due in the Next Days dashboard. So according to federal regulations, we're required to review the care plan every time an MDS is completed. Some states may have additional or more stringent requirements, and facilities often have their own internal policies that go beyond the minimum standards. It's important to know what your specific facility requires in terms of the timing and frequency of these reviews. At my current facility, we review the care plans after completing the MDS, but we also conduct a formal review within 7 days of the assessment reference date for all OBRA assessments. This means the IDT needs to review the relevant care plans and sign off to confirm they've been reviewed. Once that's done, I'm responsible for locking the care plan reviews. At my current facility, I also handle reviewing the care plans for the nursing department. So what I usually do is open up any upcoming care plan reviews. If a care plan review is due today and I haven't yet reviewed the nursing portion and signed off on the review, I'll write the residents' names down in this box here and make sure I review it at some point today. Now, ideally, if I'm up to date on assessments and things aren't too hectic, I'll review and sign off on the care plan reviews the same day I complete the portions of the assessment. But that's not always realistic depending on how busy the day is. So I depend on this dashboard to help me keep track and to remain in compliance. The next thing I do is run a report called Order Listing Report in PCC. This is a PCC-specific report that pulls all physician orders within a selected time frame. You can customize it in countless ways using different filters to get exactly the data you need. What I typically do is adjust the time frame to span from the last date I reviewed the report up to today's date. I select active, discontinued, and completed orders, then run the report. This gives me a comprehensive list of all new, discontinued, and completed orders during that period. At some point during the day, I'll go through this report to identify any changes that might require follow-up actions, such as updating the care plan, updating the Matrix 802 state form, a document that most MDS coordinators are responsible for maintaining or at very least assisting with. This form must be provided to state surveyors anytime they enter the building. Adjusting the ARD on an MDS, or scheduling a new MDS assessment. Sometimes I'm prompted to review current assessments I've scheduled, especially if something comes up that could impact quality measures or reimbursement. For example, if a resident on Medicare is started on IV fluids, I might consider adjusting the ARD or scheduling an interim payment assessment to capture that service, as it could be financially beneficial for the facility. I may also adjust the assessment reference date of an assessment for the purpose of managing quality measures. If you're interested in hearing more about my tips and tricks for optimizing QMs and capturing conditions for reimbursement, feel free to leave a comment below. Additionally, the order listing report can sometimes flag residents who may need to be screened for potential significant changes in status, which could trigger further assessments. If your facility isn't using PCC, that's totally fine. The key is to determine the best way for you to review physician orders daily. This is going to help you to stay in the loop and to catch any changes that may require your attention as an MDS coordinator. The next thing I check is whether or not I have any physician recertifications that need to be prepared for the doctor or physician extender to sign. I usually handle this task on Mondays when I look ahead to see if any recertification dates fall within the upcoming week. If there are recerts due, I jot down the residents' names here, then I pull the certification forms either from my binder or in my case from my documents folder. I prepare the forms and send them to the physician or extender for signature. Once they're returned, I save them and cross them off my list. At my current facility, I'm responsible for handling all of the managed care updates and authorizations. I use a calendar to keep track of upcoming review dates. While I've used the PCC dashboard for this in the past, and it has been helpful, I found that using my calendar is just easier for me at this particular center. Every morning I check the calendar and I write down all of the reviews that need to be completed. I note the resident's name, the payer, and once I send the review, I mark it off. Since some insurance companies take a day or two to process reviews, I'll keep them on my sheet until I hear back. Once I receive the new authorization approval, I will then update, upload, notify, and compare. I go over that full process in detail in my course. If you're interested in learning more about managed care and the roles and responsibilities of an MDS coordinator, please make sure to check out my virtual training course that I'm now offering monthly online. I'll leave a link in the description box below. Next up, I check my MDS In Progress queue. In PCC and really most electronic health record platforms, you'll find a queue showing all open MDS assessments that have been scheduled. I check this each morning to see what assessments need to be locked today or in the upcoming days. I'll jot down the resident names and assessments here and make sure my team members know which sections I'm still waiting on for completion. Now, I try to stay within 7 days of the assessment reference date, which doesn't always happen, but I do my best. I also make a note of any assessments I want locked that day. Of course, you have federal completion timeframes you must follow, but on top of that, some states or facilities may have stricter guidelines. Again, my goal is to stay 7 days ahead. This gives me a cushion if something unexpected pops up. But if you're new to MDS and you're unsure about the completion timeframes, make sure to check out my OBRA and PPS scheduling videos, where I go over those in detail. I also write down the names of any residents who need pain interviews completed within the next 7 days. At this facility, that's the only scripted interview I'm responsible for ensuring gets done. Since I work remotely, I create an order for the nurses to complete the interview and then check to make sure the responses are documented in the pain interview assessment forms that they've created at the center. I'll check back later in the day to make sure that they've been completed. Now, depending on your facility, you may have other daily tasks to complete. At this one, there's not much else I have to do daily. Occasionally, I need to complete a restorative evaluation form, so if that's on the agenda, I just add it to the miscellaneous section. Then I know any meetings I have for the day. For this center, I attend daily clinical meeting via Zoom, our weekly PDPM huddle with the therapy program manager, and then monthly QAPI and triple check meetings. Once my daily agenda worksheet is complete, I begin my day. Of course, surprises are always going to pop up. Phone calls, questions, urgent emails, and when they do, I just address those things, jump back into my worksheet, and keep moving. And if I don't finish the task listed on my worksheet by the end of the day, I carry over those tasks to tomorrow's worksheet. I wanted to leave you with a few tips that have really helped me over the years when it comes to staying organized and getting things done on time. Prioritize time-sensitive tasks. Start your day with the tasks that must be completed today. There are so many time-sensitive duties in the MDS world, and knowing your timeframes is essential. Some people will say, always do your MDS assessments first, but that's not always realistic. If I don't have any federally due assessments for the next 5 to 7 days, but I have 5 managed care reviews to submit, 2 NOMNICs to issue, and a care plan review due today, those are my priorities. It's easy to judge our productivity by how many MDS assessments we locked, but that's not always an accurate measure of what was most important to complete. Focus on what must be done first, and the rest can follow. Sequence your tasks wisely. Sometimes we get into a routine that isn't the most efficient. For example, I used to upload the authorization approvals into the medical record. I would then update the authorization calendar and then notify the team of the update by email. But with my father of 7 children brain, by the time I got to writing the email, I'd already forgotten the next review date, and I'd have to go back, reopen the document, and find it again. A small delay, sure, but it all adds up. Now, I review the authorized days and levels, I notify the team first, including the next review date, then update my calendar and upload the authorization to the medical record. Again, that may seem like a small and an insignificant change, but just switching the order in which I complete those tasks has saved me a lot of time. Find those little adjustments in your processes. They really do help you work smarter and not harder. Set boundaries and communicate clearly. This one took me a while to learn. As a nurse, you have the skill set to do a lot. You can perform nursing assessments, insert IVs, administer medications, perform wound care, etc. But not everyone understands the complexity of what you do, like interpreting and abstracting physician diagnoses and assigning ICD-10 codes for purposes of billing, coding an MDS correctly, managing physician certs in compliance with the Medicare guidelines, or scheduling MDS assessments correctly. You have a very specific skill set now that is needed by your employer to ensure ongoing compliance, that quality care is achieved, and that we're receiving accurate reimbursement. Sometimes coworkers may ask you to take on extra tasks that aren't necessarily yours to take on. It's okay to say, "I'm really sorry, I can't help with that today." That doesn't make you a bad team player. It just makes you someone who knows how to protect their time, stay within their role, and meet the responsibilities they're hired on for. Not to say if we have the time and can make adjustments to our schedule to help support our team, we don't. All that I'm suggesting is to be mindful of what's on your plate and what you realistically can handle. I hope you found this video helpful, and if you did, please don't forget to like, subscribe, and click the notifications bell so you don't miss any of my upcoming videos. Don't forget to check out my upcoming course schedule. I'm now offering a 3-day virtual live training every month, and it's a great opportunity to dive deeper, get questions answered in real time, and connect with other MDS professionals. Also, if you'd like to support the work I do here and get even more out of it, consider becoming a Patreon member. As a member, you'll get access to exclusive content, weekly live presentations, free merch, and access to the private No Stress MDS Discord channel where you can network, ask questions, and hang out with others in the field. Thanks again for watching. I'll see you next time.
Thank you for joining us for No Stress, MDS. If you have suggestions for topics you would like to see covered, we would love to hear from you. For additional resources, education, and MDS merchandise, you can find us on the web at www.nostressmds.com. Until next time, remember, you can take the stress out of MDS by putting the puzzle together, one piece at a time.